Okay, class, where we were now starting on the occipital bone. That's it in the back. That's the occipital bone. Okay, the things to name, the lambordal suture. Okay, you see this suture here? This is the suture that separates the parietal bones from the occipital. The foramen magnum is this big hole right here that the spinal cord comes out of. The occipital condyles are these things right here, and what they do is articulate with vertebrae number 1 that we'll be looking at a little later. The external occipital protuberance is that hump at the back of your head that you may can feel. All right. Now, okay, sutural bone is basically no more than the bones that form when the sutures are closing. So when these sutures close, they form a sutural bone up in there as they close. Now let's just speak on that real quick as a side note. Fontanelles and sutures. The fontanelles are the big spaces and the sutures are these spaces here. Let's just speak on what's the purpose, physiologic purpose of the fontanelles and sutures. Allows rapid brain growth. Because see, the brain is growing real big. When you deliver a kid, if you get a chance to, I'm OBGYN, you'll find the head is quite big of the kid. And generally the head comes out first. It allows overlap during delivery. In other words, the head is so big that the mouth of the cervix won't let it out unless the skull bones slightly overlap. And it would overlap at these suture areas. Now, medical uses, we can determine the fetal head position in the uterus for delivery. They can use it surgically to help with hydrocephalus. Remember, that's the cerebrospinal fluid obstruction thing. And also, based on when they close, determination of fetal age. So these are kind of some of the, and then we have anterior fontanelle. So that's what that sutural bone is. That's what that sutural bone is. Okay, let's go to temporal bones. Let's keep moving here. All right, the temporal bones are obviously in your temple. Here's the temporal bone right there. All right, let's look at it. The squamosal suture is this suture right here, separating the temporal bone from the parietal bone right there. Okay. External acoustic meatus, that's the hole that you'd be hearing from in the ears. Mandibular fossa, that's this area here. It's where the head, that's actually where your TM joint is. See, the TM joint, sometimes people have temporal mandibulitis. That's where the temporal bone articulates with the mandible. But this depression right here, let me see if I can look and see a skull. That depression right there, do I have one? I want one upside that I can look at okay, right there. That depression right there, that's the mandibular fossa right there. And that's where the condylar process of the mandible is going to fit right there to form the TM joint. Okay. The mastoid process, let's do that. The mastoid process are these big humps right here on the side. Let me do another picture. That's that mastoid process. Okay, let's see if I can find it on another. Okay, this one here should. That's that mastoid process. Big. Now, this muscle that you turn your head with called the sternocleidomastoid, it attaches there. Okay. The styloid process is this little pin thing here. The styloglossus muscle, tongue type, muscle attaches there. The carotid canal, I got to go underneath to get to it. Let's go underneath picture. I might be able to get it here too, if they have it. No, it's hard. You have to really be under here. All right. The carotid canal, let me show you there, is going to be right here. And what it is, that's where the carotid artery comes in coming off the aorta type of thing. That's the carotid canal on both sides. The jugular foramen is veins are generally wider. That's where the artery supplies blood to the brain. That's the carotid. The jugular is venous supply, bringing it back to the heart. And that's the jugular foramen right there. Okay, the internal acoustic meatus, I'm going to have to go inside the skull to show you. So you had the external acoustic where it came in, and then the internal, because this cranial nerve needs to get the stuff to the brain. So here's that internal acoustic meatus right there. Okay. So that's what you're looking at there. There's some other features like the Petra's ridge and some other things, but I'm kind of holding with her list this time. Her list. All right. The hyoid bone, let's do that, is really a sesamoid bone. It's a bone off to itself. Now let me see if I can find that hyoid bone. I need a neck picture. And I may not. There we are. There's the hyoid bone. It's right there. It's a sesamoid bone, which means it doesn't articulate directly with another bone. It's called a hyoid bone. Muscles attached like the hyoglossus muscle and so forth like that. Different muscles. You have suprahyoid muscles and infra below. Okay. Where are we now? We're now going to the sphenoid bone, the wedge bone they call it. Okay, so we're going to do the sphenoid. All right. The sphenoid bone, I'm trying to see, is this right here in the orbit there. So to see it, I really want to go to an inside picture. This right here. All right, that's your sphenoid right here. This bone, see, it's right behind that frontal bone. That's your sphenoid. All right, the sella turcica, we're going to start with that structure right there. The sella turcica is where your pituitary gland sits. It sits in this saddle right here. Sits in that saddle. That's where your pituitary gland. Now, I want you to look at this here. Look at this in pink. You see how this looks like a wing and down here looks like another wing? See, I say down here because this is an upper floor. So see 3D would show it with a model. So you step down and you end this floor down here. So it has two wings, this sphenoid. The greater wing is this one down here. See, it's a bigger wing. Okay. The lesser wing is this one up here. That's the lesser wing of the sphenoid. The sphenoidal sinus, remember that was a hollow space. Remember we showed the frontal sinus? So I come back and let me see if I can find. So right here is your sphenoidal, another hollow space covered by a mucous membrane. The orbital fissure, I'm going to go inside the eye socket. See right here, you have this right here. See, we have two fissures. We have a superior orbital fissure and inferior. But that superior is really within the sphenoid bone, the superior orbital fissure. But we have actually two, a superior and an inferior. Stuff comes through there. The optic canal is right here. That optic right there, that optic canal, or some call it the optic foramen, is where your cranial nerve 2, the one you see from, comes through. The optic nerve. The medial and lateral pterygoids. Let's see if I can find those for you. I'm going to have to go underneath. Here. All right. Right here are your pterygoids. These little ridge looking things. Let me see if they're labeled for you. Okay. These are your pterygoids, these little rough areas there. And I don't think they even label those things. But these little rough areas. The pterygoid, what attaches that are your pterygoid muscles. So these are your pterygoids right there. Okay. And actually they didn't even name those. But these, if you had the skull, you rub your edge across there, you'd see those rough areas. Okay. So that would be the medial, that'd be the lateral. Medial's closer to the middle. All right, so now we're going to a bone that's really pretty much totally within the head. You have to dearticulate that to get to it. And I'm going to go to that bone now. And that's what we call the ethmoid bone. So let me find it. All right. The ethmoid bone there. There. Let's see, where's that ethmoid? Here we are. All right. Here, right here, is the ethmoid bone. Okay. It's within the confines, hidden up in there. Right up in here. So you have to kind of take the skull apart a little bit to get to it. All right. This right here, if we had the skull, let me see if I can find it. Right there, there's a shark fin. See, that's the ethmoid right there. That's that ethmoid. Right here, you could almost hold the skull up by that if you could see it. And that's what we call the crista galla. The crista galla right here attaches to the meninges. So if you're jumping up and down, it attaches to the meninges so the brain doesn't jump up and down in the skull. That would be that crista galla right there. Okay. Which on this one, where did we go again? Would be that. Okay. The cribriform plate, come here, is lateral to that. These little holy regions right there. And when you get into A&P2, I'm going to show you that your olfactory nerve receptors go through there. Because the olfactory nerve would be up here. Let's see, did I put a picture? Yeah. There's the olfactory nerve. And going through those little holes on the cribriform plate are the nerves fibers so that smell can come up and you can get it. That's the purpose of that. Here it is again. That's that cribriform plate right there. Okay. The perpendicular plate of the ethmoid. Okay, to do that, I need to show you this here. This right here, this perpendicular plate of the ethmoid, forms the superior aspect of the bony nasal septum. See, here's your bony nasal septum. See, if you put your hand in your nose, the septum you feel is a fibrocartilaginous septum, but it passively follows whatever the bony septum dictates. So the perpendicular plate of the ethmoid is that superior aspect of the bony nasal septum. That's it there. And on this drawing is that right there. The ethmoidal sinus is another hollow region. Let's go back to our sinuses. The ethmoidal sinus is another hollow region covered by a mucous membrane, and it's right there. All of them together are called the paranasal sinuses, and I'll talk more about that in respiratory. What else we got? The nasal concha, or I'm going to come back to the nose, to a front view. Okay, you see these little stick-off points here? These are going to be important to make your airflow in the nose go turbulent. Turbulent in order to filter and moisten. Again, a subject for respiratory when we get there. So, their name from anatomy are the nasal concha. This would be the superior nasal concha. Then we have a middle and an inferior. Okay. The superior and middle are coming off the ethmoid bone. So here, we go back. That would be these here. That's like the middle one. It's hard to see the superior. But the nickname for those, because they make the air go turbulent on you, the nickname are called the turbinates. So we're going to close here. That closes, so we're through with the ethmoid.